Jen Stevens' cancer was thought to be early stage, but a specific test showed her cancer could come back years from now aggressively. Because of that, a team of specialists from Penn State Health St. Joseph Cancer Center came together to come up with a treatment plan to eliminate that threat. Jen Stevens is a woman who surrounds herself with people, both friends and family.
Married for 20 years. I have two boys who are 14 and 16 who eat me out of house and home and keep me busy.
She stays active and on top of her health for them.
I just had my routine mammogram, which was put off it should have been the end of May. I didn't have it till the end of August because of COVID. And the very next day I was able to get in for my mammogram. Thankfully, St. Joe's calendar was opened up. I went right from there to diagnostic to the scheduling of a biopsy, which resulted in my diagnosis of breast cancer mid-September, which just blew my mind. And there was no way I would have found it on my own through, just a self-exam because it was buried so deep. The doctor said you wouldn't have found it until it was very advanced, until you felt it.
Doctors talked Jen through her different surgery options.
The two contraindications to breast-conserving therapy that I always discussed with patients, and I discussed with her, were a large tumor and an otherwise small breast, or what we could describe as multifocal disease, meaning multiple tumor deposits. So in the absence of one or both of those situations, both options would be available to her. And I think for her, based on the size of the tumor, the size of the breast, her desire to keep her breast, she elected to proceed with definitive treatment in the form of breast-conserving therapy, which was a partial mastectomy.
Surgery was complete, but revealed her treatment was not.
We were actually surprised in her case because she went through our multidisciplinary tumor board process. She was seen on that day, and she had a relatively small tumor that we didn't think would need chemotherapy originally, but this is why we do some of the tests that we do. And one of the tests that was used was something called the Oncotype DX, which is a test that was developed to answer exactly that same question, which is why is it that some women have small cancers that then end up being more aggressive compared to other women. And usually, if you don't have a high Oncotype score, you get radiation afterwards to prevent the tumor from coming back in that same breast. In her case, the Oncotype score came back high, and therefore she ended up needing chemotherapy, and we followed that up with radiation afterwards. So it did change things a little bit, but that's why we do the Oncotype score in patients like her.
Chemotherapy was cresting the hill of a roller coaster, and the anticipation was worse than the actual treatment. And once I got over the hill, everything was fine. My oncologist, he kept saying, "You're going to be fine. You're going to be fine." And I didn't believe him because how do you know you're going to feel until you get done? And I had some tiredness and I had a few slight things, but really I sailed through chemo. It was unbelievable.
So the chemotherapy was every 3 weeks. It consisted of 3 different chemotherapy drugs. The first 2 drugs were Cytoxan and Adriamycin, very common drugs that we use for breast cancer. We do that every 3 weeks for 4 treatments. So that's 12 weeks for that part of it. And then we move on to weekly treatments of another drug called Taxol. And that Taxol is, it's a lower dose preparation, a lower dose drug. And women actually tolerate that much better than they tolerate the Cytoxan and Adriamycin. So the total treatment in that situation is about 24 weeks.
My younger son, he goes, "I don't care what happens to you as long as you don't lose your hair." Of course, I lost my hair. And then at one point, one of them said to me, "Mom, are you going to die?" And that was really hard to hear. But I said, "No, buddy, we caught it really early. It was stage 1. I said, I think I'm going to be fine. We're doing everything we can do to make sure that I'm going to live a really long life."
16 months after her diagnosis and surgery, chemotherapy, and radiation, that's exactly what she's doing.
There's just no reason to not get checked, and you can head this off at the pass. It does not have to be a death sentence, but it gets tougher as time goes on. Jen's surgery was inpatient, and many women who have a similar procedure are also able to go home the same day. They can then resume light activity within a week.